Fatigue, lack of energy, reduced sex drive. Lord, no, anything but that. Well, these are just a few of the symptoms that many men experience as they move towards the second half of their lives. These are my people. The widespread condition is called low testosterone, or low T for short. It often goes undiagnosed. However, it should not be ignored because it could be associated with other health risks. Joining us today on Life According to Alan is Dr. Mohit Khera. He's a urologist at Baylor College of Medicine. He's here to discuss the signs, the symptoms, the diagnosis, and treatment of low T. Good morning, Dr. Khera.
Good morning, Alan.
Now, some viewers say, well, he's just getting old. You know, we know that. Some people will say life begins at 60, death begins at 61 if you don't take care of yourself. How do we approach this?
Almost everyone's heard of menopause, but not many people have heard of andropause or male menopause, which is really just the same phenomenon. Realize that men lose up to 1 to 2% of testosterone every single year, starting at 30 years of age. So younger men have higher levels of testosterone, and older men have lower levels of testosterone. Some studies have shown that roughly 39% of men over the age of 45 have low testosterone. Think about that. 39% of men over the age of 45 have low testosterone.
Yeah.
It's not surprising that testosterone now is the fastest growing medication in the United States, with a sales growth of 40% per year.
Mm-hmm. So the Justin Bieber's okay, but about 10 years later, around 30, it starts
to be a problem.
And we decline every year. What are the signs or symptoms of low T?
There are many signs and symptoms. My patients that come in have low energy, decreased sex drive, erectile dysfunction. They start getting increased fat deposition, decreased muscle mass. They start complaining of depression, poor REM sleep, and even decrease in cognitive ability.
Mm-hmm. It sounds like a couple of those symptoms will be diagnosed by our wives, but there must be something more scientific for diagnosing low T.
Well, Alan, you need two things to diagnose low T. First, you need a simple blood test. Most of us use a cutoff of about 300 nanogram per deciliter. The second thing you need is the patient has to have the signs and symptoms of low T, such as low energy, low libido, decreased sex drive.
Mm-hmm. Well, what about these athletes? We hear about them taking steroids, high levels of testosterone, and the problems they've had.
Some athletes will take very high levels of testosterone, 3, 4, 5 times the normal range. The goal of testosterone replacement therapy is to take a guy who's low and put him back into the normal range.
When it comes to treatment, you know, we already are inundated with commercials for products, and we have our meds cocktails that we take in the morning. What are some of the treatment options? Some simpler ones, I hope.
So, Alan, unfortunately, there are many treatment options. Roughly 70% of the country are currently using solutions where they rub on their shoulder, under their arm, on the inner thigh. They apply these every day. There is the risk of transference. In other words, you have to be careful if a female partner or a child touches the skin where testosterone was applied. Many patients are also using injections, which they inject every 2 weeks. The problems with the injections is they spike your testosterone level on day 2, and they tend to crash them on day 14 or 21, so they're not very consistent. Some patients are using patches. The problem with patches is that roughly 37% of patients can develop a skin reaction. A very popular testosterone treatment therapy now is a pellet that's a testosterone pellet placed underneath the skin. This is an office procedure which is usually placed on the side of the hip, which lasts about 4 to 5 months. There are a few risks, including bleeding, infection, discomfort, and also expulsion, which means the pellets try to come out of the incision.
Always good to hear about treatment options. Are there any risks?
Some men also may develop something called erythrocytosis, which is an elevation in the red blood cell count, anywhere for up to 40%. At very high levels, some men may experience hair loss or breast tenderness. And remember that testosterone may lead to infertility, so you want to be very careful in using testosterone in men who want to have children.
Good to know there are answers. Dr. Khera, thanks for taking the time to raise our awareness and educate all of us on this important health issue for men. If you want to learn more about low T, go to lowt.com.